Hello students, welcome to All About Nursing channel. So today's video is going to about the burn. Basically this video focuses on the management on uh, specifically on fluid management, okay, and along with that we are going to discuss some nursing diagnosis and nursing care, okay. So before knowing the fluid management of burn, so you have to know what is burn injury. So a burn injury is damage to the skin or other tissues caused by heat, chemicals, electricity, sunlight or radiation. So there are different methods or different aspect from where we can got the burn injury. So it can be from the heat injury, it can be from the chemical, it can be from the electricity, it can be from the sunlight, or it can be from the radiation also. So anything that causes the damage to the skin or the other tissues, so that is called burn injury. The injury results in the destruction or damage of the affected tissue, and its severity depends on the depth, size and location of the burn. So the burn is depend that how much severe of your burn injury is. It is completely depend on the layers, the skin layers. We all know there are different layers of skin. So involvement or damage to the how much extent of the barrier, the skin structure is involved in the burn injury. Depending on that, the severity is measured. Okay, the degree is measured, the degree of burn injury, that is first degree, second degree, third degree. So that is depend on how in depth the burn affected your tissues, skin structure. So depending on that is the depth is measured, and as well as we can calculate the total body surface area by calculating by using the different formula in case of adult and in case of pediatrics. That is 9 rule and 5 rule of 5, rule of 9 is there. So from there we can calculate. So that is different part that can discuss in other video, okay. So from there we can categorize the severity of burn injury, okay. So next, coming to the basic, the foremost signs from where we can identify that the burn injury causes the major signs. There are different symptoms are there that we all know, that the skin became peel out, there is pain, there is different symptoms are there, but we are going to discuss some signs that we can find in burn injury patient, like tachycardia, that is increased heart rate, hypotension, that is low blood pressure, that possible sign of shock because of major, due to the burn there is major loss of body fluids, okay, blood, body fluids, plasma all become distracted due to the burn injury, and that leads to hypovolemic shock. So that hypovolemic shock, the major sign from where we can identify the patient is going to develop hypovolemic shock, that is tachycardia and hypotension. Tachypnea, rapid breathing to manage the oxygenation of the tissues, that is tachypnea, increased respiratory rate is there. Altered level of consciousness, pallor or cyanosis due to the lack of perfusion in the tissue and cells. Next, fever or signs of infection we can get. Then decreased urine output due to the dehydration, signs of dehydration, kidney injury, massive loss, so that leads to decreased urine output, kidney injury, acute kidney injury. So those are the signs where we can get from the burn injury patient. But the symptoms is, there are different symptoms are there due to the, depending on the severity of the burn, first degree, second degree. So depending on that there are different symptoms are there, like pain, there is peeling of skin. So there is different symptoms are there. Next, coming to the major part, that is the management. So we are going to discuss the basic, that is the fluid management. So only we are going to discuss the fluid management, only the so where in case of adult we are going to manage the patient by using Parkland formula to replace the fluid of the burn patient, which is a major responsibility, major management. So we have to transfuse a major volume to the patient to manage the hypovolemic shock. So here we use the formula, that is Parkland formula. So where the formula defines that the formula is 4 ml into body weight into percentage of TBSA. that is total body surface area. So percentage of burn, there we can get that in patient the patient who have undergone burn injury, there in their file there is written that how much percentage of burn is there, how much body surface area is involved, that is 60% burn, 50%, 40%, 30%. So by simply calculate that 4 ml, that is a constant, multiply with the patient's body weight in kg, multiply with the total TBSA, that is percentage of burn injury. So as for example, you can see if the patient body weight is 70 kg and patient burn is 40% burn TBSA, so where we have to multiply 4 into 70 into 40, so that is 11,200 ml. Okay, so that is the total volume we have to give to the patient in first 24 hours of burn injury. So if the patient came to you, so you have to calculate the fluid by using this formula, and you have to get the total ml for first 24 hours. So first 24, if the patient came to you for 8 am, so you have to you have to calculate the volume, and you have to give the volume, total volume from 8 am to next day 8 am. Within that you have to complete that amount of volume fluid to the patient. Okay, so how you have to give, like you have to divide this total amount of fluid in two division, equal division. Okay, and first half you have to give within first 8 hours, and second half you have to give within over 16 hours. So you have to give half of the fluid total. Suppose you are getting 11,200 ml. Okay, so this 11,200 ml of fluid, you have to divide it into two equal division, and after division we get 5,600 ml. Okay, so 5,600 ml of fluid you have to give in first 8 hours, and next same 5,600 ml of fluid you have to give over next 16 hours. So like that you have to transfuse the fluid to the patient to manage or to combat the situation. Okay, and basically we are prefer the Ringer-Lactate RL solution, prefer for first 24 hours, and avoid colloid solution like albumin. In initial phase we have to avoid this. We have to first start with the RL or the Ringer-Lactate or solution for first 24 hours. Okay, and we have to continuous parameters that have to be monitored, that is urine output adult 0.5 to 1 ml per kg per hour. We have to check for the urine output, constant hourly urine output should be checked, and mean arterial pressure should be increased, should be maintained, MAP should be maintained more than 65 mm of Hg. Okay, and heart rate should be decreased, should be tachycardia, hypovolemia should be managed. Okay, and patient should be try to regain the consciousness of the patient. Okay, responsiveness of the patient. So next, coming to the major, that is nursing management, and we all know that nursing management is dependent on the nursing diagnosis. Okay, so the first diagnosis, that is fluid volume deficit related to plasma loss from the burn injury, as evidenced by hypotension, decreased urine output, dry mucous membrane. Next can be risk for hypovolemic shock due to the massive loss of fluid volume or fluid loss due to the increased capillary permeability from the burn, loss of fluid. Next, impaired skin integrity due to the destruction of skin tissue from the burn. Next can be acute pain related to tissue damage depending on the degree of your burn injury. If the patient has in-depth, means 3rd degree burn, so there is that much of pain we can't get from the patient. Okay, so depending on the degree of burn, so pain level is varied. So okay, next we can write the diagnosis like risk for infection, that can be there, anxiety, there is different diagnosis, imbalanced nutrition, there is different diagnoses are there.